So it is one of the most used psychotherapies across the world with one of the strongest evidence bases. It's cognitive behavioural therapy, and this video is all about everything you need to know. If you're new here, warm welcome. My name's Dr. Sil. I'm a junior doctor from Australia, and I'm training to become a psychiatrist. I work on mental health wards, usually treating illnesses like schizophrenia, bipolar, depression, personality vulnerabilities and disorders. And a big part of psychiatry training is psychotherapy. That's right. In psychiatry, it's all about the biopsychosocial spiritual approach, which is biological stuff is things like medications, but psychological things is psychotherapy. And then social and cultural things we can talk about in other videos, but that's also very important. So let's just jump straight into what is CBT. So cognitive behavioural therapy, which I'll probably just call CBT for the rest of the video, is really based on the assumption that our brain simply does three things. It thinks, it feels, and it drives behaviour. Thinking, feeling, behaviour. Now, these things are kind of a cycle, but if we are able to kind of work on our thinking and our thoughts, it can drive changes in our feelings and in our behaviors. So people, for example, who might have negative self-talk. So maybe it's easier if I give you an example of what I mean by thoughts, feelings, and behaviors. A common example is I'm trying to lose weight, but I'm finding it really hard. I'm unable to, which makes me feel depressed. And because I'm feeling depressed, which is my emotion, I then have a behavior which might be to binge eat. And then that will then lead back into the thought of I'm trying to lose weight, but I'm finding it really hard to. And you can get these really negative cycles. When we go through the core principles of CBT, we will give, some insights on how to challenge that cycle. CBT has been around for almost 60 years. It was kind of conceptualized in the 1960s by Dr. Aaron Beck, and it has been proven effective for a range of different disorders, the most common of which are depression, anxiety, PTSD, OCD, and many others. There's even CBT for psychosis. And honestly, my point of view is if you can afford it and you haven't tried it before, it's definitely worth trying. It's always important to remember that the key thing that predicts whether a therapy will work for you is not the acronym of the therapy. It's not the style of the therapy. It's your relationship with the therapist. There is just something extremely healing about sitting in a room with someone who you have a therapeutic alliance with, someone who gives a crap, who's trying to understand you empathetically. And through that work, it doesn't really matter what kind of therapy they do, there's better outcomes. So for example, if you were doing CBT for depression, which has a strong evidence base, but it was with a therapist who you weren't really clicking with, who you didn't find empathized or wasn't really trying, was distant, was getting distracted, whatever, versus, some psychodynamic psychotherapist, but you found that they were super involved and connected and you could really feel that there was an alliance there, then it's probably better to do option B. There's just something healing in a therapeutic alliance. That being said, I want to make a shout out to boundaries, okay? It's not about finding a therapist that's totally involved in your life and like your best friend. That's not the role of a therapist. It's very important to have boundaries and to set clear boundaries and to not be too close, to be the right distance. But this video isn't about boundaries. Let's keep going with CBT. Now, the core principles of CBT, well, there's many, but the five main ones I want to talk about. The first is identifying negative thoughts. This can be also talked about like negative self-talk. These are kind of automatic, almost like spontaneously generated beliefs. And that are, some examples might be, I always make a fool of myself in social situations. I'm not interesting. I'm ugly. I can't do that. It's really important to find a negative thought and targeting that as part of the start of changing that cycle that we talked about before. Now, the second principle is about challenging these core beliefs and negative thoughts. And it can be helpful to have a piece of paper. There are, PDFs online that you can use to do this. But essentially what you want to do is write down the negative thought. I always make a fool of myself in social situations. And then you want to do an evidence assessment, check the evidence for, you might have a couple of examples where you did make a fool of yourself in social situations. And then look at the evidence against. and write down all the reasons that thought is not the absolute truth. Once you've done the evidence, then you can look at the evidence and try and form a more nuanced, more realistic, more constructive view, which is everyone might make a fool of themselves from time to time in social situations, and generally I don't do that when I objectively look at the evidence. Now, the third principle that I wanted to cover in CBT is focusing not only on the thoughts, which we talked about, but on the behaviors. And it's very interesting, but sometimes the thoughts and mood follow behavioral change rather than needing to change your thoughts to drive a behavioral change. Sometimes thoughts follows behaviors instead of behaviors following thoughts, is what I'm trying to say. And what I mean by that is, even if you don't feel like it, writing down a bit of a plan for the day that includes exercise, that includes calling a friend, that includes doing some work, whatever, then you'll find, just by being activated, by using this vessel that you're in, the body, to be productive, to do things, even if it's very small things like making the bed or planting a seedling, like, potting a plant. Doing these things can then actually spontaneously, strangely drive the thoughts, which then drive the feelings, which then drives more positive behaviors. So it's really about where in that cycle that we're trying to target. And I think something I've noticed in my experience in CBT, it's very hard to target the feelings straight away. You can't just kind of be like, cheer up. What you have to do is target either the behaviors or the thoughts or both, and the feelings will follow. And sometimes it takes a week, or sometimes it takes a couple of weeks. But if you do have a productive, active set of behaviors that you do every day, then you'll find that thoughts and feelings do follow. The fourth principle in CBT is actually just problem solving. And this is kind of a psychoeducation component of the therapy where you are provided with information on how to manage your anxiety. It should be personalized. But different people have different strategies to manage their anxious thoughts, to break themselves out of rumination, which is when you're kind of stuck in a cycle of worry and thoughts about the future or the past, really. And, some people find mentalization, meditation, mindfulness, yoga. There's lots of different ways to manage anxiety, and it's about finding the thing that works for you. And that's kind of captured in this whole psychoeducation component. Now, the fifth principle. Now, this one's more used in situations of anxiety and PTSD, and it's about exposure, exposure conditioning. So if you have anxiety about leaving the house, a part of CBT is, you assess the reasons for and against. You make your kind of assessment of these reasons, try and reframe and have a more nuanced and constructive position, but then it's about the behavior and challenging yourself a little bit. It's done at your pace. It's a safe thing to do. Don't be scared, and don't let it block you from trying CBT. But it does help to just do little tests and little increases in exposure. Some therapists try flooding, but that's not often done in CBT. It's really about just increasing the exposure to whatever is an anxious stimuli, to the point where it becomes less and less anxiety provoking. You desensitize to it. Now, in terms of the structure of CBT, how it's actually run, essentially you have usually 60-minute sessions, or there's sometimes 50-minute sessions. They often start at 5 past the hour and end at 5 to the next hour. And there's usually about 12 to 20 sessions in a course of CBT. You work with your therapist to identify the different goals that you have, and then your therapist helps you. Now, in those sessions, let's talk a little bit about the techniques that you might learn in the course of the CBT psychotherapy. Now, the first technique to use is all that cognitive restructuring. And this, how we said identify the negative thoughts? Well, negative thoughts usually occur in these patterns. Things like overgeneralizations, things like all or nothing thinking, and the third thing being catastrophizing. So, if I just hit my elbow. Catastrophizing. If I leave the house, I will make a fool of myself, and then I'll lose my job. Then identifying that negative self-thought and then processing it and restructuring your thought content to be like, well, maybe I naturally have an anxious predisposition and I might catastrophize the outcomes of things. The evidence for it is actually not that strong, and I can actually try leaving the house a little bit, going to work, and maybe I won't lose my job, which would be a more balanced perspective, which is the goal of CBT. Also, I know these examples are simple and maybe, they make it sound easier than it is. I'm sorry, I'm not trying to minimize how hard CBT is. It absolutely is. It's like going to university. You're essentially doing a university course in your own brain. So I'm sorry that I'm simplifying it, but it's just for the purposes of education. Another technique is actual just behavioral experimentation. We've kind of talked a bit about this without using those words, but it's about testing those negative beliefs. So, I can't talk to girls because they'll hate me. And the behavioral experiment might be to just try a low risk version of that. So maybe, joining a chat room or playing a video game and talking to a person that way, and then building up to an in-person catch up with a cup of coffee or something, whatever it is. Your therapist might actually also ask you to keep a thought record, which is essentially a diary where you write down and, in a structured format, thoughts that you get throughout the day. And then afterwards depending on how your therapist wants to do it, but you can then challenge those thoughts. But that's important in cognitive restructuring. We've spoken a little bit about the next technique, which is mindfulness and meditation. There is strong evidence to support that these practices do help with anxiety, depression, and rumination. The next technique is graded exposure, which is really about that exposure stuff that we talked about earlier. So say, for example, someone has a phobia of a spider. Graded exposure would start with just looking at a photo of a spider, then maybe having a spider in a jar in the room, and you're just grading the anxiety levels. So you start with the photo, you look at the photo, you have an anxiety level of 7 out of 10, and you hold the photo until that anxiety drops to 4 out of 10. And then you can go to the next step, which is to have a spider in the room, and your anxiety will be 8 out of 10, but you keep it in the room until the anxiety goes to 5 out of 10. And eventually, some people and some therapists will get a spider on their hand, which for me would be anxiety 10 out of 10. But you just, you wait, you sit with it, you realize it's not going to bite you, you realize it's safe, and your anxiety will drop. I don't know how much your anxiety will drop when you have a bloody tarantula on your hand, but hopefully a little bit. And you become more comfortable with having spiders in the rooms and things. So that's an example of graded exposure, but it doesn't just apply to phobias. It can apply to anything that generates anxiety. And the next technique, which really strongly correlates with the behavioral activation thing, is scheduling. The number of people that do not have a schedule for the things that they should be doing with their time to behaviorally activate, it's so common. So we need to have a schedule. I live my life according to my calendar. If it's not in my calendar, I'll forget about it. It's really important. Now, getting started in CBT. Well, in Australia, you need you can go directly via a private route to a psychologist, but that's pretty expensive. The cheaper option is to go to a GP and to get a mental health care plan, which provides you with a number of sessions at a Medicare subsidized rate, so it's cheaper. And then you can find a psychotherapist. And there's different tools online to find local psychologists that do different therapies. So just Google CBT in my area, and there'll be a bunch of psychologists that do it. I would say, I don't know what percentage, but a majority of psychologists would be experienced in CBT. So it should be readily abundant. For those who cannot afford it, which is probably the majority of people, and for those who don't have access to it, which is also a strong majority of people, a big proportion of people, I should say, there is evidence for telehealth CBT, so you could do it online. But if you don't want to pay, there are online CBT courses, and they have evidence that they work. And also, I'm making my own CBT course the next time I have some free time. So that's going to be a bit of work that I want to work on. I'll put a link to my newsletter in the comments below if you're interested in doing my CBT course. When it comes out, then I'll send it through that newsletter. And yeah, it'll be fun to make, and hopefully it'll be helpful for some people. All right, that is it for this video. Thank you for staying till the end. Remember that seeking therapy is a form of strength, not weakness. It is much harder to ask for help than to just, hold all this crap inside. So please do get help if you think you would benefit from it. And I just wish you guys a wonderful day. I know this stuff is hard, and all you have to do really is to get to the bloody door. After that, the therapist will guide you. And for people who have got trauma histories and things they don't want to talk about, please don't stress. You do not have to bring it up. You don't have to process it. You don't have to talk about your traumas if you're not ready to. That stuff is done at your pace. It is still helpful to do CBT even if you don't want to go into that trauma history. Yeah, and that's it for this video. Cool. All right, see you in the next one, guys. Bye for now.